My name's Adam Scott. I'm one of the colorectal surgeons or bowel specialists working here at Spire Hospital in Leicester. And it's very important that April is Bowel Cancer Awareness Month. Bowel cancer is not only one of the commonest cancers that we come across in the UK, but it's also, if caught early, one of the most treatable. So the earliest bowel cancers, the so-called T1 bowel cancers, are almost always cured, often without the need for any major surgery. Those earliest cancers tend not to cause symptoms, and we have to go looking for them through so-called screening programs. So that if you are invited to take part in a screening program, there's a national screening program looking for blood in the stool that cuts in at the age of 60, but there are also other local screening programs going on, and if you are asked to take part in a screening program, you'd be mad not to, because they are very successful at detecting these early, easily treatable bowel cancers. If a cancer becomes a little larger, then it can cause symptoms. And the sort of symptoms that we're looking for are a change in your bowel behaviour or possibly bleeding. And everybody tends to find these symptoms a little embarrassing to talk about, but really it is very important, and doctors see patients with bowel symptoms, all the time. We all have slightly different bowel habits. Our individual pattern of bowel behaviour will vary from person to person. What's important is if you find your bowel habit is changing over a period of about 3 weeks or more and persistently has altered, especially if it means that you're going to the loo more often with looser stools, then that is something that is worth talking to your doctor about, and he or she will probably refer you for investigations. The other common symptom is a bleeding from the back passage. Now, when somebody has bleeding without a change in bowel habit, that generally isn't a significant symptom, but it should not be ignored, and again is worth reporting to your doctor. So the bleeding is either something you might just see on the loo paper or in the toilet, or it can be blood that's mixed in with the motion, and any of these should be reported and investigated. So the importance of Bowel Cancer Awareness Month is simply to raise awareness of the sort of symptoms that bowel cancer can cause, and to make us all understand that it's important to report these symptoms and have them investigated, because generally this is a fixable problem.